Hello, this is a physician from Shanghai, and as you know, now we are experiencing the city lockdown. As you can see, there is no cars in the parking lot in the entire Shanghai. So, especially like for physician, and we are mandated to do their community quarantine because I work for a private hospital, and all the our pharmacist, our nurse, and many staffs that are also mandated to do their community quarantine. And my time is start from I think it's March 26th, and now is April the 7th, so it's almost 11 days, and we are required to stay at home. And even for the community, you cannot just walk around. And as you know, maybe you search the internet, many houses are now out of stock of foods, and many of them have to buy online. But you know, the delivery services are facing a very stressful, so not each one can get the delivery. So for my staff, many people they get up at like 5:30, round the clock, and just to wake her or himself up to buy things online. But some people they are good luck, they buy things, and some people they are not good luck. And from the community level, the government is now sending their vegetables and some food for us. But for my home, we have 5 people, and maybe the next door is only 1 people. The things are the same, so it doesn't make any like sense for us because the things the government give us, maybe you can only keep for one day and you run out of it. Again, today I received some medications from their government, which is interesting as a physician's point of view. Why you send me their medications I don't need? And it's called 莲花清运. It's like a traditional Chinese things, and we cannot eat it to prevent the Omicron virus. The only thing maybe you can take it is when you have like a little fever or something. But once you have a fever, maybe you need to get to see the physician. But now you are cannot to see a physician because you are mandated to stay at home. So I think maybe it's time to think about whether we need to stick to the we call the dynamic clearing policy, which means zero infection in China, because the Omicron virus is very easy to transfer from people to people. And according to some data, it's the R0 is almost to 12, which means 1 people can transfer it to 12 people. And also the death rate is very low. Currently in Shanghai, there's no one death because of the Omicron virus. And we look at the data at the United States and the United Kingdom, and also the death rates are not as high as Delta virus. So maybe it's time to think to stop it because people are not afraid of the Omicron virus. We are afraid of hungry. We are afraid of there's nothing to eat tomorrow, and we are afraid of maybe we have other diseases, but now you cannot seek medical help. For an example, one of my patients, and she is confirmed with breast cancer, and she needs to do the chemotherapy, like routinely chemotherapy, and she needs to change her PICC tube. But currently, she cannot go out of her community because the community says you need some like clarifying documentations from the hospital says, okay, you need that proof of paper. But actually the hospital says you only need that discharge material from the hospital that can prove that you have that kind of disease, and you have to do the routine chemotherapy routinely. So that for that point, it's ridiculous for a patient who needs chemotherapy and cannot get the regular treatment because of their mandated quarantine for all the people in Shanghai. So I think maybe we are doing too much protection to protect this virus, which is not can be protectable. And maybe we need to think more about actually there's more patient, more people. They are really sick, not because of the coronavirus. They are sick because other reasons. Maybe they have diabetes, they have COPDs. So maybe it's time to stop that policy. I cannot upload in local, so today I share a physician's perspective and opinions on YouTube, and maybe you can know things are really very hard in Shanghai now for the city lockdown. And although we want to help people, and it's the best thing, even for my patient, I can't do any other things for her. So that's why people are asking help online, on microblog, and on WeChat. So it's time to think to change the policy, not say zero infection. Maybe it's time for us to consider whether we need to live with the virus because it's virus. If we can conquer virus, maybe we can conquer the tumor. But currently, tumor is considered as chronic disease. So that is my point of view today. I will upload day by day from a physician from Shanghai, China.